Hi, this is Larry McNeely, the healthcare advocate with US PIRG here in Washington, D.C. It's early August, which means D.C. is hot and Congress has gone on recess. As you may have seen from some of the media headlines, there's some concern about the prospects for healthcare reform right now. But the truth is, over the last few weeks, huge progress has been made, despite the dust that's been kicked up in the debate. The fact is that those of us who advocate health reform can and will win reform this year, if you and I step it up this month. Here's the situation. In the House of Representatives, all three of the committees with jurisdiction over health reform have passed versions of the American Affordable Health Choices Act, H.R. 3200. The House will be looking to reconcile those choices over the next several weeks and have a floor vote this fall. The Senate's Health, Education, Labor, and Pensions Committee, led by Chairman Ted Kennedy of Massachusetts, has approved its bill, the Affordable Health Choices Act, as well. And a majority of the Senate is anticipated to back that bill. So now the real question. How did PIRG's priorities fare in all these different bills? Fantastic. All four bills include a ban on pre-existing conditions and medical underwriting. They include payment reforms to reward quality, not just more tests and procedures, comparative effectiveness research funding, and a public health insurance plan. The House bill even has a provision to set insurance efficiency standards so that consumers know that their premiums go to care, not insurance company red tape and executive compensation. But I must say, in the last committee, the fifth out of five committees, the Senate Finance Committee, the road is rockier. Negotiations to produce a bipartisan bill are still ongoing between a group of 6 senators led by Chairman Max Baucus and Ranking Member Chuck Grassley. The plan that this group produces may not be the plan that PIRG would write, but it would definitely be better than years more of rising costs and denied care. Remember that we're going to need 60 votes to pass anything serious in the United States Senate over filibuster. And even though there are 60 Democrats, some of them simply will not vote for a health reform bill without some Republican support or cover. Now, I should say that the Republicans who are negotiating seem to be doing so in good faith, but they're under serious pressure from the rest of their caucus, who are excited by the prospect of defeating a president of the opposite political party's signature initiative. One senator, Jim DeMint of South Carolina, has even said that he wants health reform to be President Obama's Waterloo, and that, quote, this will break him. So how is all this going to come out? Will the House deliver a strong bill? Can Max Baucus actually persuade a few Republicans to get seriously behind a bipartisan deal on health reform? Well, I don't have the answers to that now, but I can tell you one thing that is certain. The opponents of reform are out there and mobilized. Rush Limbaugh and the industry front groups this August are going to be telling anyone with ears to hear that they need to call their legislator, go to a town meeting, really do everything they can to oppose reform. And these groups, funded by industry in a lot of cases, are definitely going to be spending lots of money on television advertising to oppose reform and spread fear about this idea. If these attacks go unanswered, the opponents of reform will certainly win. But the majority of Americans still badly want and need lower healthcare costs. Now that means we can win. But only if those who care about health reform work harder than ever to win real change, real affordability, and real security in folks' health care. Nothing less will win. The time is now. Next time, next year, even next month, could be too late. So to return to the question we asked a few minutes ago, how will this come out? The answer depends on you.